speaking curriculum that we have in the medical school, and he will give us a talk about challenges in selection of international medical students.
Thank you, Mr. President. So my task is to speak a little bit about selection of international candidates. And this is not a new problem for the globe. So it's a universal challenge. And this can be proved by the number of publications in different journals, among them JAMA or New England Journal of Medicine. So in Greece, we have a past, which is the current situation, and we make it a little bit different when we are selecting our students. As you know, we align them for an academic test, the final year, and we receive the best of them. The problem is that all are not starting from the same line. And as you can see, this year, we received 131 with the general examination, but we are ending up with 160 with the different categories and finalizing with 368 starting the year for different reasons. So there is a question of equal acceptance. Why is happening this is because we are based in two wrong hypotheses. The first one is that the best students in the school merit to study medicine. This is honestly not the best work in the world. Hypothesis two, the best students in high school will make the best doctors. This is also not true, and we know it from our daily life. So we are asking people to write an exam on physics, chemistry, biology, and dissertation, a plaster one. We do not accept free expression in this dissertation. It should be framed. So we only judge them with their academic performance and none of the personality traits. Still, we're producing, let's say, good doctors. Why is this happening? Well, it will not if we continue like that. In very short time, this will end. Why? Because we don't have the same social network as we did previous years. We don't have the same homogeneity in our society, and we have this inherent characteristic in our tribute that will change. So the world is different, and we have to just break this Gordian knot. So let's go to international medical student selection. The selection is a prediction. It's not a selection, it's a prediction. Who of the candidates will have the potential to develop the right competencies we want? So it is a prediction. Every prediction has an error. We have to admit that. So we may make a wrong pick. And during the years of the medical school and the residency, a lot of things can happen to this person. So the time frame is very big. All competencies cannot be developed sufficiently from everybody. We have to accept also that. So 3% this is international data, 3% of people who are starting medicine will stop for academic reasons, okay? And there is also another example that everybody is not good for this work is the patient's complaint list. If you are going to see in the system that they registered, we will see that the complaints are basically on communication and attitude. So this is the list of things that we are accused. So during the 6 years, it's impossible to improve radically this. So there is a role for the selection process to block prone characters to these attitudes. And for that, there are specific tools. And there are specific tools from psychology. They already use it for employees, and they already use it for pilots. So the role of selection is to exclude personalities that don't fit to the medical profession. This is one thing. The second is to find the resilient students, because resilient students will make resilient doctors. there are a lot of reasons why we need resilience in medicine. And there are a lot of things that medical schools should do to avoid that. But this is not the topic of this presentation, and I believe that Professor Βασιλικός will touch it. But before that, we need to identify the best candidate with mental resilience and emotional stability. So the first fundamental question related to the selection process is what kind of doctors we need, not on a national level, but on an international level. So needs are different in India, in China, in Australia. Of course, we have a common core for every physician, but the delivery of this healthcare is different in different areas. So in some places, you need more research doctors. In other, more general practitioners. In other places, you need doctors that they know how to manage risk. Take the pandemic crisis, or in other, the organization of health services. So international medical school, like OSOM, they need to widen the radar of global needs and adapt the programs. They have to think globally. The second fundamental question is what competencies we need for this ideal doctor. Well, the list is clear. We need high academic ability, ability to understand science, and good cognitive skill, as simple as that. But there are more than this. We need well decision-making skills. Think about that in the daily practice. Integrity, high moral standards, excellent interpersonal skills. Confident communicator, ability to function professionally under stress. This is our life. We need high level of self-control, do not take inappropriate risk in a practice setting, and of course, as I said, resilience. So once we have defined the competition, we have to find the tools to find this competence. So there are traditional tools like our national exam, and UK, US, they are well known. I will not go through that. But there are also tools for non-academic competencies, like the personality admission test, like Cambridge has organized, or the reference letters. The reference letters tell us a lot, and the personal statement. Interviews. There is a lot that has been said about interviews. It's a universal tool. It is a valid tool for non-cognitive abilities, the soft skill, as we are saying, but there are a lot of controversies regarding reliability. So there is a low predictive validity, cost effectiveness, of course, because you need 15 minutes, 20 minutes for every student, every candidate. But still, in the interview, you can find all these things, and you can organize your interview such a way that you can go through that. In some places, US, Australia, and UK, it has been proposed recently to do the multiple minute interviews. These are stations, 6 stations usually, 10 minutes each, where there is a scenario on different action. So like professional judgment, prioritization, tell us what you will put in your backpack for hiking, for instance. So this is not science, but it shows the personality. And what has been proved is that they have very good predictive validity and reliability. Another tool is the situation judgment test, and that can be linked very well with what Professor Bamidis just said you, that we can create scenarios, video scenarios, and put this candidate in a situation that not what he will do, but what he do, actually. So it's great for interpersonal skills and the assessment of personality and emotional intelligence. Why to see that? Because if we block them, they will need less support during the medical course. Some reflection from our experience: is a country of origin a factor of selection? Well, our democratic values will say no, but if you want to promote, you can even favor this candidate if you want to promote low-income countries, for instance. Or is the age a factor of selection? Well, if you want to think the composition of the group, then you cannot allow a lot of mature students. Is the cultural difference a factor? Of course, you can promote that because you want cultural exchange. You want people functioning as your ambassador. Is the physical disability a factor? We all would say no, but you don't want to discriminate these people. But of course, severe disability can limit practicing. So the selection process should be valid. How we assess the selection process, and I'm coming to the end, well, by track. We have to keep records from everything we are doing through the selection process till the end, and then after the graduation. This is very important. And then we may change what we want to measure also. Maybe we need more doctors in underserved areas or more in specific fields, and we have to change what we are showing to our students ourselves. We have to change the model. So we are doing most of these things that I just mentioned in our practice with the admission requires, and as a conclusion, I will say that the selection of the right medical student from a large number of intelligent and highly motivated young people in a highly competitive environment is challenging universally. This is not happening only here. Selection depends on societal needs. We are a public university. High academic profile is a prerequisite, as the others. Ability to understand science, mental resilience, emotional stability, and we have tools to look about that. Thank you very much.
Thank you, Professor Φόρογλου. We'll go on with the next speaker, who is Professor Βασιλικός, who will give us a lecture on the curriculum of international studies in medicine.